Martha Gray takes her mammograms seriously, knowing both her mother and aunt were diagnosed with breast cancer in their early 40s. Martha just turned 50.
I would ask every year, is there anything else I need to know? Or is there any new research?
The teacher from Holy Trinity persisted a bit more this year when talking to her doctor back in January and decided to take Norton Cancer Institute's high-risk assessment. She'd tested negative for any genetics that may play a factor, but she had extremely high odds with her family's history.
To me, it's the Holy Spirit. It could be your sixth sense. It could be that little voice inside saying something, isn't right.
Her mammogram came back clear. She pushed for an MRI and then an ultrasound. Ultimately, it was an MRI guided biopsy that found the invasive breast cancer on her left side.
I made the decision to have a double mastectomy.
A week after surgery, she learned the mammogram and MRI had missed cancer on her right side completely. Martha's oncologist, Dr. Laila Agrawal, says mammograms may not catch 10 to 15% of cancers, and here's why.
There can be some breast cancers that are too small or don't show up well on the mammogram, and there's other breast cancers that come up so fast that a woman may have had a normal mammogram even a few months ago and then feels a mass herself, which turns out to be breast cancer.
She says screenings are still the best way to detect cancer early. Knowing your family's history and the signs are even more important when becoming your own advocate. Martha's had to step away from her students while she recuperates from surgery, but they've made it very clear they're ready for her to come back.
They surprised me one day with a Zoom where they were all wearing pink t-shirts. It's bittersweet, I guess, but I can't tell you how lucky I feel.
In Louisville, Brooke Hash, WHAS 11 News.